Hello, it's Kim back again for this week's case study, and here I go. Okay, quick refresher again, just remembering where I am. I'm at Tulip Special Care, 60-bed nursing facility. It specializes in the care of folks who have been either still are on ventilators or who have, recently come off ventilator. It's like a respiratory care specialty place in Philadelphia. It employs one RD and then myself, the intern. The patient I am talking about again is MW. So this is my third time I've been able to speak about him in these case studies. He is a 53-year-old African-American male. He just had a birthday last week. So my prior one said he was 52, but now he's 53. His height hasn't changed. His weight has changed. He's put on 2 pounds since the last time I presented, which is great. His BMI is like slightly higher now because of that, still only at 15. His usual weight is 190, and his ideal body weight would be 160. Such a dramatic difference because in 2018, he was diagnosed with ALS and then has, his weight has really dropped off. So that explains the weight loss. The diagnoses in blue are what acute problems brought him into the hospital, and then he was discharged from the hospital to us. And he still has all of the white diagnoses are just kind of like more of his chronic things that he is living with. So he's living with ALS. He is a functional quadriplegic, breathing issues, COPD, emphysema. He is on a ventilator. He is improving. He's able to be off the ventilator for a little bit, which is great. And this week, anemia was removed from his list of active diagnoses. And these all were abnormal when I started presenting on MW here, and they mostly have all normalized, which is great. Glucose is normal at 83, CO2 is normal. Creatinine is still low, but it is getting higher, which is great. His other renal labs are fine and have been fine. So his BON is normal and his GFR is normal. And then as you can see at the bottom, his anemia was taken off his list, and his blood levels and things are normal now, which is great. Relevant medications haven't changed. He's still on some pain meds as needed, collapsed lung and stuff. He's still on this blood thinner. The respiratory meds that I just labeled as respiratory meds last time, it's just the forms of albuterol that are used by the respiratory therapists in their whole realm of practice. And then he is still on a bunch of vitamins because of his malnourishment. Social history, nothing new. We still know he was in music production. He's single. He has a daughter. He lives with his mom, who helps with his care. He has a home health aide who comes out 2 to 3 times a week. Lifestyle history, he has, he was dependent on nicotine. He has past alcohol use, has past drug abuse. Once he was diagnosed in 2018, all of those had basically stopped. And he has not gone back to them since, as he reports. Okay, so the nutritional focused physical exam findings, he still presents with severe weight loss. He is gaining weight, however, which is great. He still has a severe loss of subcutaneous fat and muscle mass. Again, his edema is down even more from last time, which is great. And he does have reduced grip strength, but again, he has ALS, and so he's going to have reduced grip strength anyway. Nutrition care process. So for him, it's still the same. He, still presents with malnutrition. Severe malnutrition in the setting of chronic disease related to advanced ALS and recent hospitalizations, as evidenced by a BMA of 15. Now it's 15. Significant reported weight loss of 39 pounds in 6 to 9 months, at 27%. Noted edema and severe loss of subcutaneous fat and muscle mass. So that itself has not changed, although we are seeing improvements, which is great. And here is more about that. So the interventions, I've given us more detail this time around about the interventions we're doing. So we do have him on night tube feedings. He came in with a PEG, and so he is getting Gevity 1.5 at 65 milliliters an hour for 12 hours. So they just hook him up at night. Total volume 780, which gives him 1170 kcals. He has a freshwater flush of 50 milliliters an hour for those same 12 hours. His free water amounts to 1192. Which works. During the day, he has been encouraged to eat orally, and he has been doing really well with that. Last I checked his calorie count, it was around 1,000 calories. I checked 2 or 3 days worth, which which is really great. And so that actually puts him up at upwards of like, this was just kind of like the guess considering if he was getting exactly 1,000 PO. 2170 kcals a day, which works out to 45 kcals per kilogram of body weight, which is high, but folks with COPD and ALS and who are recovering from severe malnutrition, it's kind of on target there. And he has been tolerating it really well. So that I think is also the key, is that he's gaining weight and he says he feels better. So that's great. Monitoring and evaluation isn't any different. We're just monitoring his PO intake. He's on calorie counts. We're adjusting his tube feeding amount and rate. If you've noticed, you probably didn't, but in case you did, we lowered it a little bit from last time because his PO intake was so good. So I think last time he was getting 70 or 75 an hour over the night hours. Now it's down to 65. We're going to continue to monitor weights and labs, tube feed tolerance, and then evaluate that data and make adjustments as needed. Oh yeah, and he's getting discharged, which is great. And so I guess I'll back up to the monitoring before I end here. We are preparing for discharge for him, which is great. So he is going to go back home. We're sending him with everything he needs. He will continue night tube feedings from home. The dietitian and his ALS specialist have already kind of talked about the plan for that, which is pretty much the same thing we're doing here. So they'll continue to see how much he's taking in orally through the day and then make adjustments to the tube feed as they feel that it's needed. But this is like a great story. Actually, I'm happy to be able to say this. Not tons of people are going home from the facility that I'm at because it can be it's like long-term care. So this was actually a really nice, way to wind up this last case study. So anyway, I hope you've enjoyed hearing about MW, and see you next time.